All right, hi there, it's Dr. Buford. We're just getting started on the left knee. We're looking in the medial or the inside part of the knee. We've already harvested two nice hamstring tendons for the ACL reconstruction, and now we're just looking in the medial compartment to confirm that there's no significant cartilage or meniscal injury. This is the root of the medial meniscus way back here. And as we look at that, hold the shavers for a second. As we look at that, that's checking out okay. We're just flushing a bunch of water through the knee as we go. But there's the root, that looks good. The cartilage on the tibial plateau down below looks good. As we look here on the femoral condyle, that looks good. We'll get our first peek at the ACL injury here. We confirmed that your knee was very loose under anesthesia. And now as we look inside, we can see why. This is what's left of the old ACL. You have what we call this empty lateral wall. There's really no significant normal appearing ACL tissue in the notch here. This is not normal ACL. That's maybe a little scar tissue and what's left hanging on. The posterior cruciate ligament's behind the shaver here. And this is a little bit of the ligamentum that if we don't remove will block our view. Okay. And so now we can see all the way up to the patella at the top of the screen there. And I don't see any significant cartilage injury in the trochlea. We'll look at the patella in a little more detail in a minute. But for right now, this confirms the diagnosis of a complete ACL tear. And we'll go ahead and fix that like we talked about. We're going to look in the lateral compartment next. A lot of times there's meniscal injury over here that goes along with having an ACL tear. Hold the knee there just like that. And as we look at this meniscus, we can see the posterior horn. Of course, we have the MRI scan to help us make the diagnosis, but we always look just to make sure. This lateral meniscus is, let me see a probe if you have one. This lateral meniscus is looking okay so far. And what you'll see in just a minute is our probe coming into the picture. Okay, so here's our probe. We can feel the meniscus. A lot of times there's a little injury underneath the meniscus here, and you do have it. You have this undersurface tear. See that little tear in the meniscus right there, but we need to assess how stable it is before, so there's the tear right there. See that? So push down with your right hand, push down, left hand, push down on the knee right there. Maybe straighten this just a little bit, yeah. Okay, so that's good. So here's the meniscal tear right here. We're going to have to decide what to do with that. Okay, so we can see how that's nearly split there. Okay, you had a tear that was kind of difficult to deal with because there were a bunch of thin pieces of meniscus, and I think most of the time before we had some kind of modern techniques, we used to just trim that kind of meniscus tear out. But you're so young, I hate to remove any of the meniscus if I can avoid it, so we spent a little extra time here trying to put a stitch, a circumferential stitch around it, which is what you can see there to hold that. If it doesn't heal, we can always come back and take out the part that doesn't heal, but man, if we can get some of that to heal, I think that'll be to your benefit. So we're going to stop there. That's the meniscal repair there. Okay. The rest of the meniscus looks pretty good. We're going to look up at the patella here. We had a sneak peek before, but now we can see the patella a little bit better, and that looks pretty good. The trochlea looks good. And now we're ready to go. Come on, background Garth. We're ready to get to work on the ACL reconstruction. Just put your body up against his knee so he doesn't come off. All right, so if you want to add that to the procedure, Sarah. So we're doing ACL reconstruction and lateral meniscal repair. Or Dr. Hines, whoever cares. Okay, I just didn't mean on the paperwork. I don't know if the, no big deal. That certainly was indicated. No. So tell them it's going to be another 45 minutes. Yeah, thank you. Yeah, no, I just hate saying something when I'm in the middle of. How old is he? 17 and some change. Yeah. Do I? No, I started here. Our office used to be in the Landry building right down the street over there. And then we built a hospital where I spent the next 13, 14 years over at Pine Creek. Yeah, and so then we sold that about 2 years ago, and they ran it into the ground as fast as possible. Yeah, they were very effective. And I mean, you couldn't have done it better if you had just literally plotted it out. Well, that's what we did. When we sold it, we're like, the final decision was like, I have no confidence in you guys, but if you guys want to pay us enough so that once you do run it into the ground, we can buy it back or something. Yeah. So now so we built some of us built a surgery center that we go to and obviously still coming here. But I've never been to Carrollton. I used to live in Las Colinas, but even then I never. Yeah. For a minute, I saw patients up at what do they call it now? It used to be Deadman. RHD used to be RHD. What's it called now? Up there, right at like Webb Chapel 635, where Kyle Stewart goes sometimes. Anyway, that place is not a medical facility that I would take people to. But I've pretty much just been in one place.
What's going on with the creek?
With Pine Creek?
Yeah.
No, they're in bankruptcy now. They paid themselves first and then they ran it into the ground. Yeah. Yeah. Uh-huh. Yeah. It's just crazy that we had no trouble making that place do very well for such a long time. You know? Hold the camera here. Do we have that intra-articular bovie also or no? The long one? Yeah, let's get it. The long bovie, the.
First thing to deal with the investments that you like to use for knee scopes and so forth, you know what I mean?
Yeah. I guess that's what they. Yeah, that's what. Oh, hold on. Is that what she's getting? Yeah, we can use that. Yep. So in that case, no, we'll just use this. This is perfect. the edge.
Heard you here, Thailand successfully recovered a handful of patients that have the coronavirus.
Who did?
Thailand.
Really?
Oh, wow.
They used some. That's a hand control.
Uh-huh, yep.
They used certain flu treatment mixed with the HIV treatment,
Huh.
and I think they said their patients recovered within 48 hours.
Wow.
I don't know if I want HIV to be my cure.
HIV treatment.
Yeah, HIV in the name would be. I got to read the fine print on that consent. Yeah. So let me get. Yeah, he did.
They usually have a live or dead strain in there.
Yeah. I mean, basically, HIV, it's just a diagnosis now. Nobody really. And I think you're right. Magic was kind of the first public person that really had the diagnosis that. He's probably the first person to be on like triple therapy or whatever they started doing, you know? Still not a test I want to.
Educate the long sons.
Yeah. Yeah, whatever happened to. What's his name? Magic's son's name?
Oh, I don't know.
Yeah, I think it's. Is it Irvin also?
I think so.
He actually named him Irvin thinking he might get a chance in the NBA, and he couldn't have been more wrong. I don't think his son's got a TV show. I think he had a TV show on
A
like.
TV show.
He's got the height to play hoops.
Yeah.
I might bet you he's never put on a pair of high tops though. Not on a court. No, I do not. Okay, we're done talking about Magic. And this is what the tunnel looks like, blah, blah, blah. Obviously, I'm going to redub this. Okay. No? Okay, great. Okay, hold the camera roll still right there. Yeah, I'm going to have to redub the whole thing anyway, so you can say shit and damn and... Hey, oh, not you. Okay, I just want to show them the graph. Oh, wait a minute. Let me see the edge. He's got it.